Hello, this is Dr. Ahmed Al-Jaishi. Today we're talking about creating effective trial materials, everything a potential trial participant might see or receive. By the end, you'll be able to identify the essential components of effective materials for pragmatic trials, navigate regulatory must-haves and ethics board expectations, learn what to include, what to avoid, and how to create materials that are ethically sound, appealing, and culturally safe. First, what do we mean by trial materials? For this module, these refer to any participant-facing materials that might help people understand what the study is, decide whether to join, and stay engaged if they do. These materials serve different purposes across the recruitment lifecycle. Some materials attract attention, like recruitment posters, while others help maintain engagement, like visit reminders. Other examples might include flyers, website content or landing pages, invitation and reminder letters, social media ads, SMS text messages, emails, and so on. There's a difference between recruitment materials and retention materials. Recruitment says, hey, this study exists. Here's why it matters, and here's how you might fit. Their goal is often to convert awareness into enrollment. Examples of materials used are posters, social media ads, initial invitation letters, and trial website content. Retention materials, on the other hand, say, you're already in. Here's what happens next, and we appreciate your participation. Their purpose is mainly to maintain engagement and show appreciation. These include visit reminders, progress updates, thank you messages, and study newsletters. Because pragmatic trials run inside everyday clinical workflows, your materials aren't competing for attention in a controlled research environment. They're being read in waiting rooms, during shift changes, on phones, and often under stress. So the goal is simple: make them usable, respectful, and easy to act on. First, these materials must be inclusive by design, meaning these materials should be accessible to people with different literacy levels, language preferences, and cultural backgrounds. If someone needs plain language, translation, or culturally safe framing, your materials shouldn't be the barrier. Next, they need to be accessible everywhere. A poster that works in a research clinic might fail in a busy emergency department or a small rural practice. Keep information concise, scannable, and adaptable across settings and formats. And finally, they should feel familiar and friendly. If your materials read like a complex research protocol, you lose people. Use everyday language. Avoid jargon. Don't assume prior knowledge. The best materials feel like routine care communication, not research paperwork. And once your materials are built, they need to pass ethics review. Research ethics boards closely review participant-facing materials because these materials can shape decisions. If the language is confusing, overly optimistic, or even subtly pressuring, that's a problem. The board's job is to make sure what you're saying is accurate, balanced, and not coercive. That includes posters, flyers, emails, texts, scripts, website copy, social ads, newsletters, everything. Practically, that means you wait for formal ethics approval before anything goes out. No printing, no distributing, no emails, and no social posts until you have the green light. This brings us to one of the fastest ways to get materials sent back for revision: allowable versus non-allowable claims. One of the most common mistakes is slipping into promises that sound reassuring but go beyond what the study can honestly support. These might include statements like, This treatment will improve your health. Participants will receive better care. Or, this medication cures symptoms. Those are guarantees, and they imply benefits you can't prove in advance. What you can say needs to be grounded in uncertainty and purpose. We're studying whether this treatment may improve symptoms. This research compares two usual care approaches. Or, we hope to learn if this intervention is helpful. The difference is that allowable language stays honest about what's unknown. It describes what the research is trying to discover, not what it will deliver. Another area where good intentions can backfire is how you describe incentives. Compensation is common in research and often appropriate, but the phrasing matters because the line between fair recognition and undue influence can be thinner than people think. Keep messages around compensation factual and low pressure. Participants will receive a $25 gift card per visit. Parking costs will be reimbursed. Or, compensation is provided for your time. The goal is to acknowledge time and effort, not to sell participation. What you want to avoid is language that promotes money or creates urgency, like earn up to $500, get paid for helping research, or don't miss this opportunity to receive. That shifts focus away from the study and toward payment, potentially influencing decisions in ways that undermine truly informed consent. Next, once your wording is ethics safe, you still have to meet the basic information checklist that REBs expect to see in recruitment materials. The exact details vary by institution and format. Still, the same core pieces appear in posters, letters, and other participant-facing messages. At minimum, include the official study title, a clear purpose statement, basic eligibility criteria so people can self-assess fit, and a brief risk or inconvenience summary, even if it's minimal. You'll also need the principal investigator's name and contact information, and practical tracking details like the material version number and date, so everyone knows they're looking at the current approved version. The next item is using plain language. This means that someone can read your message once and get it, without rereading or decoding research terms. Here's an example of a statement that uses unnecessarily complex language. Participants who meet eligibility requirements will be randomized to receive either the experimental therapeutic intervention or standard care protocol for a duration of 12 weeks, with outcome assessments conducted at baseline in regular intervals throughout the study period. The same idea, written in plain language, might sound like this. If you qualify, you'll be randomly assigned to receive either the new treatment or usual care for 12 weeks. We'll check how you're doing at the start of the study and regularly throughout. Both statements mean the same thing, but the plain language version uses shorter sentences, familiar words, active voice, and a more conversational tone. Cultural and linguistic appropriateness is the next big item to consider. Trial materials should reflect the communities you're trying to reach. This means we need to be aware of varying literacy, languages, cultural values, and comfort levels with healthcare and research. Start with language access, meaning materials and participants' preferred languages, not just an English-only default. Then check cultural references. Images, examples, and metaphors should make sense to your target population, not feel generic or out of place. Build for health literacy too, so you're not assuming familiarity with medical terms or research concepts. And don't ignore trust factors, because some communities have good reasons to be skeptical of research. So your tone needs to be respectful, transparent, and grounded in what participation involves. Whenever possible, work with patient partners who share the relevant cultural and linguistic background so you can stress test the messaging and make sure it lands the way you intend. Next is accessibility essentials, because people can't join a trial if they literally can't read, process, or use the materials you're giving them. Think about accessibility in 3 layers. First is visual accessibility. Use high contrast, large readable fonts, and clean spacing so the page isn't a wall of text. Second is cognitive accessibility. Once someone can see the content, make it easy to follow with short paragraphs, simple sentences, clear headings, bullet points instead of dense blocks, and visual cues or icons that support comprehension. Third is format alternatives. Once the content is clear, make sure people can access it in the way they need, like audio versions for vision impairment, simplified versions with reduced complexity, large print options on request, and screen reader compatible digital materials. In practice, recruitment rarely happens through a single channel. Most trials are recruiting in multiple places at once. With that, each channel has different constraints and attention spans, but the goal stays the same. Keep the message consistent while tailoring the format. On social media, lead with a tight 20 to 40 word blurb, a strong image, and a clear direction on what to do next. And make sure you're compliant with both platform rules and ethics approval. For clinic posters, go bigger and more visual, readable from a distance, with just enough detail to make someone stop, and a QR code that takes them to more information. That more information should live on a website landing page, where you can be more comprehensive. Organize content with headings, keep it mobile friendly, and make the next step obvious. And for SMS reminders, keep it short and neutral, direct, actionable, and respectful, like a simple reminder with a time and an easy way to confirm. Here's an example of patient-facing trial materials from a pragmatic trial. These are designed to be clear, culturally appropriate, and accessible to diverse populations. The materials are offered in multiple languages, like English, Anishinaabe, and Arabic, and also include audio versions, which matters when reading level, vision, or comfort with written materials is a barrier. The goal is to help people quickly understand what the study is, who might be eligible, and what participation involves, without making them work for it. If you want to see the full package with all 19 languages, use the QR code on this slide. To wrap up, trial materials can directly shape recruitment and retention, participant experience, and public trust in the study. The takeaways are simple. Know the purpose of each material and where it fits in the recruitment or retention lifecycle. Align with ethics expectations by getting approval before release, using allowable language, and including the required information elements. Write materials in plain language so people can understand it the first time they read it. Design for accessibility, including visual readability, cognitive clarity, and alternative formats when needed. Adapt your content across channels without changing the core message. And whenever possible, partner with patient contributors early, especially those who reflect the communities you're trying to reach, because they will catch issues you won't. Thanks for joining me for this module. If this was useful, please like the video and subscribe to the channel.